everyone, this is Dr. G, board certified naturopath physician in Portland, Oregon, talking to you today about some lesser known supplements that are beneficial for the heart. Okay, so let's get started. Again, this video is for educational purposes only. It is not meant to replace the advice of your doctor or your other healthcare provider. All right, the first two supplements, we're going to start with the first one, B12. Yes, B12 is good for the heart. It does help the nerves, and it is needed for red blood cell production and for DNA synthesis. But B12, when it's methylated and becomes active, actually helps lower homocysteine in the body. And elevated levels of homocysteine in the body are associated with heart disease, stroke, circulatory problems, and heart attack. So you do not want elevated homocysteine in the body, and B12 can help. Now, if you get too much to B12, you're going to pee it out in the urine, but you can get headache, nausea, and vomiting if you take too much at once. If you're deficient, up to 1,000 micrograms per day can be useful. But, for maintenance, more like 150, 200, 250 micrograms daily should be fine. And this is a supplement. Usually it's better taken with food because people can feel nauseous, especially on the higher doses. And if you take it later in the day, it can stimulate your brain, so it could keep you awake. So don't take too much. Okay, the other supplement is folate, and I like to supplement these together because B12 and folate can mask. If you take one of them, it can mask a deficiency in the other, so it's better to take both. So the other one is folate, and yes, folate is beneficial to the heart. Why? Because again, folate helps decrease elevated homocysteine. And we know that elevated homocysteine is not good for the heart. Okay, if you're pregnant, you're going to want to take more folate. You should take about 600, the RDA is 600 micrograms daily. I like around 600 to 800 micrograms if someone is pregnant. If you're an adult, not pregnant, man or woman, around 400 micrograms, I feel is a good dose. And again, take it with food, take it earlier in the day because it can also stimulate the brain. And folate is also essential for red blood cell production. Okay, folate B12. Then we have one of my favorites, CoQ10. CoQ10 has probably been in the news a lot for heart health. And yes, it does seem to benefit the heart. It is an antioxidant. It does help protect cells from damage. It also seems to help prevent blood clot formation. But it may also help against cognitive decline, so brain decline and Alzheimer's disease. And there are studies on this and the other supplements and homocysteine, and I'll try to link those below in the comments. And then if you haven't seen my video on my 3 favorite supplements, I will try to link that above. But don't forget about CoQ10. I usually recommend to patients 100 to 200 micrograms daily with food. Now, some people will have their sleep disrupted by CoQ10. I have not had that problem with my patients, but if that happens, then you're going to want to take it earlier in the day. So CoQ10. And if you are on a statin, statins block cholesterol formation, yes, but they also block CoQ10. And CoQ10 is beneficial. So if you're on a statin, really, you should take CoQ10. All right, well, I hope you all are staying healthy, active, and well. Don't forget your CoQ10, your B12, and your folate. Don't take too much. And I will see you again here really soon. If you do like this video, you found it useful and helpful, please press like and or subscribe, and bye for now.